News, Washington.
Time now for our Sunday morning Q&A. Joining us this morning is Congressman Dutch Ruppersberger. Nice to see you.
Good morning,
as always.
Deborah.
All right, so we're getting ready for this bruising debate on health care reform. Where do you see it going?
Well, first thing, it's the process. The House passed a bill. That's not going to be the bill that will pass. It's now in the Senate. Now the Senate will have their debate. The most important issue in the health care is the cost. And I think that gets lost sometimes. It's so that we know that 5 years down the road that an average family will be able to pay for health care. The cost of health care per family right now, average cost of health care, is $13,500 a year. Most people don't understand that because their company subsidizes. They get their paycheck. They probably think they're paying more in taxes when it's health care.
All right, but I want to ask you a question.
Sure.
Okay, because there was this huge story out of Washington this week on the mammograms, and I'm tying it all together because of this. Because people worry that this decision right now regarding the recommendation regarding mammograms over 50 versus over 40, people worry that this is a sign of how things are going to, quote, ration with health care reform, how things will start to peel back.
It's really unfortunate, all the lack of information and all the emotion that's out there right now. And a lot of it is because people are concerned about change. Again, getting back to the issue of cost is where we need to focus. But I can tell you this, there will be choice, the continuation of choice. Seniors will have the same care under Medicare that they have now. A lot of these issues that people are concerned about are just not going to happen. And that's why they elect us to look after them, to do what's best for them. But one of the things that has to be done is the issue of cost.
All right, well, on the issue of cost, we have a couple of questions on this from several viewers.
But you said mammogram. Let me say this.
Yes.
There will be choice. A woman who has to have the test will have those tests. And that is a recommendation of a group. That's not part of this bill at all. There's an example, though, that it could be used and might scare women. The accessibility to testing as it relates to cancer will be there. That's part of what this health care bill is about, to let people have better coverage at less cost.
So do you feel that women over 40 should be having mammograms? I mean, are you down to that detail here? I mean, your colleague, Senator Mikulski, has the idea to guarantee access to mammograms at age 40 through public insurance.
I can say this. We've come a long way. Susan B. Komen, the attention that has been given for early testing has saved many lives. And I think that's the issue here. And I'm sure that the women will continue to be able to have what they need to make sure they get early detection for breast cancer,
well, they're hanging
which saves their lives.
They're hanging on every detail there. All right, I want to get to these questions here.
Okay.
This is from a constituent who says the following. What has government, on the health care issue, what has government ever run that has saved taxpayer money and done a good job?
Well, let me just say in the health care area, you have TRICARE, which is the care for the military. You have veterans who have health care. That is a good program. You also have Medicare. Now, the issue of Medicare, seniors like their Medicare, and we're not going to take away from the seniors' Medicare. If we didn't have Medicare for seniors, where would our seniors be right now? But the issue is cost, and that's why the focus has to be in this bill to turn around the escalating costs. It's the CBO, the Congressional Budget Office, has projected if we do nothing as it relates to this health care bill, that in 10 years it will be an average of $25,000 a person. We can't sustain that. Families can't sustain that. Neither can business who are providing health care.
But Congressman, you know this is a very difficult vote.
No question.
You were saying it off camera before. It's a difficult vote. And we also have an email question regarding that. And one constituent of yours writes, what % of votes do you think you will lose in the next election based on what they call your party line vote?
Well,